Good day, everyone. Thank you for coming in and joining us for our second episode of the 2025 Spring Heifer Academy webinar series. I'm Cora-okkema, your host for today. I am a dairy educator with Michigan State University Extension. And if you're coming back from previous seasons or our first episode, welcome back and hello to all of our new attendees. I am excited to learn alongside everyone and dive into another fascinating topic today. We have Jennifer Bentley, a dairy field specialist with Iowa State University Extension and Outreach, and she's going to be sharing with us today Hygiene and Colostrum. Start your calves on the right hoof. And to prime everyone for the session today, there are going to be a few poll questions, so prepare yourself for that. And we really appreciate the interaction. And you can place questions at any time in the Q&A section. We will be answering those as we go throughout the presentation. A live recording of this session will be available on our YouTube playlist, along with an audio version on Spotify. And since you're joining us today, you are registered, and so you'll receive a follow-up newsletter with the links for that. Also, please complete the post-session survey, and that's to provide us valuable feedback for future programming, but also what you really took away from our session today. I'm delighted to have Jennifer here with us today. Once again, she's a dairy field specialist with Iowa State University Extension and Outreach. Her work has been instrumental in improving calf care protocols, milking parlor procedure, and fostering community between producers through workshops and peer groups. Her practical approach provides immediately applicable tools and skills for animal care teams and owners. Today, Jennifer will be sharing insights on colostrum management and hygiene to provide the best start possible for newborn calves. Thank you, Jennifer, for taking the time to be here with us today, and please take it away.
All right. Thanks, Cora, for inviting me onto your Heifer Academy webinar series here. And are you able to see that up there?
It's up now.
Like Cora said, we're going to be talking about hygiene and colostrum, starting your calves on the right hoof. And I've presented this material to our dairy producer groups in Iowa, focusing on colostrum. And actually, my colleague, Dr. Philip Jardin, has been instrumental on including the hygiene piece as we feel this is a pretty important part of colostrum management. And so we're going to dive a little bit deeper into the hygiene part of this here today as we go forward. But to give you a little bit of outline, we are going to talk about the 5 Qs. I think when I started an extension, it seemed there was 3 Qs, and then over time we've been adding more Qs. And actually, Dr. Jardin and I have added another one that we're trying to find a Q for temperature. But we're gonna walk through quality, quantity, quickness. I'm gonna focus a lot of time on that squeaky clean, so the hygiene, temperature, and then finally quantify. So those are the items that we're going to walk through here today. So we know that colostrum is a major important factor for calf health and survival. So we see reduced treatment rates, we see reduced mortality, improved growth rates and feed efficiency, increased milk production, and decreased age at first calving. And something that we're probably not going to dive a lot into today is really colostrum benefits beyond first day of life. We're finding there's a lot of gut health benefits to offering colostrum to those calves, even beyond that first day. But for today's purposes, we're going to just focus on that first day of life. And so first we're going to start off with quality. What makes good colostrum? And that really starts with the dry cow. Even before that calf is born, there are things that we can do to maximize colostrum quality, making sure that cow is healthy and has been vaccinated properly. We know that there's a lot of vaccines that can be useful in making sure that the antibodies are useful to the farm. And so getting those transferred into the colostrum is very important. So, working with your veterinarian to make sure that those vaccines are being administered properly and timely. Balancing the dry cow ration. So we want to make sure that that cow is healthy and be able to deliver a healthy calf. And so that begins with a balanced ration. Heat abatement strategies. We know in the last few years that heat abatement has become a very important part of dry cows and transition cows. We know there's long-lasting effects to the calf and generations beyond. And so making sure that those cows that are in that dry period have the appropriate heat abatement strategies so they can produce good colostrum, as well as that calf being able to absorb that colostrum. And then taking a look at the length of dry period and the transition period, making sure that we give that cow adequate length of dry period and be able to move her into some type of transition before she has that calf. So at least 3 to 4 weeks before calving, they're moving into some type of transition. And then once she has that calf, making sure that we're collecting that colostrum within about 2 hours after calving. We know that the longer we wait to collect that first colostrum, we start to dilute the colostrum with that transitional milk and the milk that you're gonna end up putting into the bulk tank. So we want that highest quality of colostrum with the highest amount of IgGs within those first couple of hours. And then taking a look at proper milking and collection procedure. So just like in your normal milking procedure, milking your cows 2 to 3 times a day, we want to follow those same types of protocols to make sure that we're collecting it very clean, and then finally storing it properly. If we're not feeding that colostrum right away, we want to make sure that we're storing it properly. And we're going to dive into that here in a little bit. What makes good colostrum? The buzzword immunoglobulins, those IgGs, right? So that's the thing that we talk about when we talk about what makes good colostrum is how many IgGs can we get out of that high quality colostrum. And so we're aiming for greater than 50 grams per liter of immunoglobulins. Of course, the more that we can get, the better. This is ultimately going to protect that calf until they have their own immune system and it's up and functional, and it's their main defense against disease. If you look at this graph here, you'll see that that first day of life, they're really relying on that colostrum to be their passive immunity. And then there's this high risk period where they start to decrease their passive immunity until they can start to build their own active immunity. So really those colostrum is going to really prevent any disease during that first couple weeks of life. And so there's a couple different ways that we can monitor colostrum. There's some tools available to do on-farm cow side or calf side that we can take a look at. We have when I first started an extension, we were really using the colostrometer, measure specific gravity of the colostrum being put into that hydrometer there. And so it gives you a reading of green, yellow, and red. And so if it's in the green zone, we know that they're going to receive adequate colostrum or reaching that 50 grams per liter. If we're in the yellow zone, we know that that's maybe some milk that we want to feed as a second feeding or third feeding. And then if we're in the red zone, that's not going to meet our standards for 50 grams per liter of IgG. But over time and the use of technology, we are able to use a Brix refractometer, either manual or digital. And we've been able to equate the Brix reading into the amount of IgGs that are in the colostrum. So those are probably more modern tools that we're using now. They're fairly accurate as compared to the colostrometer. Colostrometer is a little bit dependent on the temperature of the milk, whereas the manual and the digital, you can take different temperatures of the milk as well. So my first poll question, Cora, if you want to launch that here, is looking at, for those that are online here today, maybe you're either a producer yourself or you consult with producers, just wanting to get an idea of what method do you use with you yourself or with clients that you work with to assess colostrum quality. So we'll give them a few minutes to, or a few seconds to go through that. And Corey, you just let me know when you're
Okay,
wanting to close that.
will do.
I guess as we're waiting, Corey, do you find you have producers using one over the other?
I'd say the digital bricks is the one I see used the most, just because it kind of weeds out a little bit of the human error on it. So, but obviously the digital bricks comes with a pretty decent price point to initially get, so there is that piece to it. But I'd say that one's the most common. All right, I'd say I'm gonna end the poll in 10 seconds. So if you have would like to fill it out, please do so now. All right, let's look at these results. So we had two folks say that they use the colostrometer. We have four folks that say they use the bricks refractometer, and one person who uses the digital bricks.
All right. Well, that's great. I'm glad to see that all of our participants are monitoring their colostrum quality. Because I think that's a very important tool, especially if we moving forward with storing that colostrum and having available high quality colostrum for
Mhm.
times when we don't have that fresh colostrum. So our goal is to get about 90% of our samples within that Brix reading of 22%. And that's going to equal about 50 grams per liter. So I know I have herds that have a higher standard. They are using 24, 25% because they just really want to make sure that they're getting the highest amount of IgGs into those calves. So quantity. So we talked about quality. Quantity is next. Our first feeding, again, we really want to maximize the amount of IgGs that we're getting into those calves those first 24 hours of life. So we want to be able to feed about 8.5 to 10% of their body weight, which is about 3 to 4 liters for a Holstein calf, or about a gallon. And then at a minimum of 150 to 200 grams of immunoglobulins for that colostrum. So if you're measuring colostrum, and so you measure it and it becomes 50 grams per liter, you can feed 4 liters or 4 quarts to that calf. But if you have a higher reading, you may be able to feed a higher quality at a lesser volume to those calves. And then, of course, more IgGs, the better. If we can get a second feeding into those calves, maybe 10 to 12 hours later, at about half the amount, to achieve even a higher amount of IgG level in those calves. We find that those calves do really well if we can get about 300 grams of IgGs within the first 24 hours of life. There have been some recent publications that I wanted to put into the slide set that I've kind of been reviewing here the last few weeks, taking a look at some research from University of Wisconsin Vet Med with Dr. Sackett and Dr. Breuer. They've been looking at, again, feeding those larger volumes of colostrum to newborn calves may not always be risk-free, as we take a look at just, the amount of colostrum that we're feeding at that first feeding can tend to give some digestive upset. And you can see here this article reported a newborn dairy calf caused by a large colostrum curd. This is a case report. And so they're trying to reevaluate some strategic colostrum management practices to really improve neonatal health. So again, kind of going back to that, if we're measuring the colostrum quality and we know it's of higher quality, can we feed smaller volumes of colostrum and maybe limit some of that adverse effects of large volume feeding? Now, I know there's going to be some future studies working on this and investigating this a little bit further, but it's something to consider and maybe keep an eye on as we go here. And then also looking at that Brix refractometer, they're suggesting feeding levels of higher concentrations of 75 grams per liter. And so if they're looking at a Brix refractometer, that's about 25%. So I've linked those two articles here, and I'm sure, Cora, you could share those with participants via email as well if they want to dive a little bit deeper into those recent publications. So we get a lot of questions about should we feed with a bottle or esophageal tube feeder? In research, it shows that they both work equally well. There's no effect of feeding method on IgG absorption, whether we feed that bottle or esophageal tube feeder. So it's kind of preference of the farm. But I would note that there is proper training procedures that we should follow. And it's important for the success and confidence of those people that are administrating the colostrum. If they don't have the confidence to use the tube feeder, they might not be as likely to use it. And then maybe this is, we see some prolonged administration of colostrum. And then, of course, going back to proper cleaning and maintenance, making sure those tube feeders don't have cracks and crevices in them, and they're fully cleaned. So moving into quickness, we want to deliver this colostrum as soon as possible after birth to maximize IgG absorption. Again, kind of looking within that 24-hour window here, we see their maximum absorption is really those first couple hours of life. And even at first couple hours of life, their ability to absorb all of the IgGs is only about 30-35%. So that's why it's so important that those first couple hours we're getting as much as we can into those calves. So the gut starts to close by 24 hours. So yes, they can absorb other nutrients through colostrum, but after 24 hours, their ability to absorb those IgGs are gone. So our goal is to feed that first feeding within 2 hours, or 90% of our calves fed at less than 6 hours after birth. Because we realize, there's times of the day where there may not be employees on the farm, maybe the calves born overnight that you don't catch right away, but trying to get as many calves in that window as possible. And then moving on to squeaky clean. So we put the Q in the squeaky here. I'm going to refer to some research that was actually done by an Iowa State University graduate. This was a nationwide colostrum management study, just looking at the on-farm quality of milk. And then how often do producers feed contaminated colostrum and evaluate the IgG and bacterial combination. So kind of looking at the quality of the milk and the IgG level at the same time. And what they found was in this study that only 55% of the samples met industry standards for bacteria counts, and 29% did not meet industry standards for IgG concentration. So when they combine those two, standards of bacteria counts as well as IgG concentration, only about 40% of those met both the industry standards for IgG and bacteria. So in their study, they found colostrum should be fed fresh or frozen immediately and not stored in a refrigerator for more than 24 hours. That's where they saw a lot of that additional bacterial growth within the colostrum. So again, kind of going back to that, the cleaner, the better. Sandra Goddard from the University of Minnesota has her guidelines there for what those bacteria counts should be. I also put in there the Dairy Calf and Heifer Association gold standards. They have a little bit higher levels there within fresh colostrum, and once it's heat treated, what that level should be. So I just encourage you, if you're working on cleaner colostrum, that you work with your veterinarian to, set up those standards that you want to have on your farm and a monitoring system for that. So on the right here is a sample of some culture results from colostrum. And you can see these really high levels here in those last two samples that were taken. And they were seeing high death loss within actually 24 to 2 days of age. And when they posted those animals, these are photos from my colleague, Dr. Phil Jardin. realize the effects of spoiled colostrum here. So opening up that abomasum, the middle picture shows what a normal abomasum would look like, but the two outside pictures can show what it looks like if you have some spoiled colostrum, and just how that invades the abomasum and causes inflammation and kind of causes rapid death right away. So something to think about if you see some immediate death loss after administration of colostrum. So kind of looking at where this invasion happens, bacteria decrease the absorption of IgGs, right? So that gut lining is open and bacteria have the ability to be absorbed. Toxins can be absorbed while that gut is open in those first 24 hours. So that decreases the absorption of IgG. So you might be feeding high quality, but if it has to compete with bacteria, we could see some issues. Then, those pathogens that can get in immediately, E. coli, salmonella, and then there's some intermediate pathogens that maybe just hang out in the body there for a couple weeks to months that you might not see symptoms until later on. And then long term, we know that Johne's and BLV can be passed through colostrum if it's not heat treated appropriately. So there's some long term effects to feeding contaminated milk. So where are we getting that? Like I said, milk or colostrum, cow skin, cow manure, milker's hands. So are we making sure that we're using sanitary equipment while we're collecting that milk? There's contamination points throughout the way, right? So just think about from the time that the cow enters the milking parlor to the time you collect that milk to the time that it gets fed to the calf. What are your processes that could cause some possible contamination? So we're going to look at a few of these here as well. So again, kind of looking at that fecal or dirty equipment contamination, we want to be able to keep the bacteria out and then also keep bacteria that sneak in from growing, right? We probably can't keep all bacteria out of the milk, but can we keep it from growing, right? So bacteria multiply rapidly in warm colostrum. So we want to make sure that we're getting that colostrum cold as quickly as possible. So I think about, when I was milking and collected that fresh cow milk, and it was a hot day, right? So I milked my fresh cows first, and I wasn't going to feed that calf until after milking, and my milking shift was probably about 4 or 5 hours. So, that bacteria double every 20 minutes. So while I might have started with some very clean milk, by the time I got done with my milking shift, that bacteria probably quadrupled in that time. So, even if you're not going to use the milk until after the milking shift, can you get it into a refrigerator to cool it down quickly so we can reduce that bacteria growth? And then thinking about udder prep, again, treat that colostrum just like milk that's being sold for humans, that's going into the bulk tank, following all those proper milking procedures and checking for any mastitic infections. So we're not feeding that to the calf. And then consider heat treatment. So this is really going to reduce, the bacteria growth as well as any pathogens like Johne's or BLV being transferred to that calf. And so we say heat treatment and not pasteurization, because this is a lower temperature for a longer duration. So 140 degrees for 60 minutes versus pasteurization is a higher degree at 145 degrees for 30 minutes. So heat treating that colostrum so we're not denaturing the IgGs in that colostrum. We do see herds using potassium sorbate. It's a food preservative, and this may be useful, but again, it's only as good as the colostrum that you collect. So if you're starting with high bacteria, it can't totally reduce the amount of bacteria in that milk, but it can slow the growth of the bacteria. So another example here of just kind of looking at, getting that milk cooled as quickly as possible. This graph on the left here shows a couple different ways that the milk is being cooled. In the yellow line, so the bottom line, is milk put into a freezer. So you can see the temperature drops fairly significantly, fairly fast, as compared to your blue lines or the orange line, where that milk is put into a bottle or put in from a bucket to a bottle and then put into a refrigerator. That takes a lot longer to cool that milk. So it's staying at a higher temperature for a longer time as compared to, getting it cooled quickly into a freezer. And then you think about the picture on the right, looking at all those warm bottles going into a refrigerator there, and you know, it's going to take a while for that milk to cool down, especially if all that milk is kind of touching each other. It's all warm. It's also going to bring the temperature of the refrigerator down, which, if you notice in that picture there, this is also a place where they're storing their vaccines. So if we raise the temperature of the refrigerator, we're also doing some damage to our vaccines as well. So if it's possible to have a separate refrigerator for vaccines versus colostrum, I'd highly recommend that, or finding ways to cool that milk down even before you get it into the refrigerator. So some clever ways that we've seen producers do that, using a small plate cooler. And again, this might be, looking at some, your inspection guidelines, what you can do within your milking system, but using a small plate cooler to cool that milk down really, really fast. We've seen people put in ice bottles, so filling some, plastic containers with water and freezing those, and then throwing those right into the collection bucket there. Having your bags lying flat in the freezer with ice bottles around them to kind of rapidly cool that. We know there's some commercial items out there now, the colostrum bags, that can help with getting that colostrum frozen pretty quickly or cooled pretty quickly. And then the picture on the far right, this is actually a pasteurizer, but they've kind of reversed the use of it. And instead of using it to heat the milk up to heat treat it, they've actually reversed it and used it to use the chilled water as kind of a jacket to kind of cool that milk down pretty rapidly. And so those are just some ways that you can look at to rapidly cool that milk to reduce some of that bacterial contamination. And kind of going back to that poor heat or that heat treatment, monitoring that system as well is going to be pretty important. We want to make sure that we're reaching the level of proper heat treatment at 140 degrees, but we also don't want to go over that temperature or have a level that's below it. So on this graph here, it shows different samples of milk being heat treated, and we see some that do reach levels above 140 degrees, and then we see some samples here that never reach the 140 degrees, and so it wasn't properly heat treated. So we're not reducing the bacteria load, killing any of those pathogens that can be transferred to those calves. So properly monitoring, any type of system that you're using to heat treat the milk is going to be important. And this just shows a good heat treatment graph, looking at the milk was about 60 degrees, and we got the temperature up to 140 degrees, and we held it there for an hour, and then we were able to cool it back down before we fed the milk. So going back to, ways that we're storing, freezing, and thawing all have impact on the quality of that colostrum. So storing the milk, again, either in commercial bags or bags that you purchase into those 2, 3, or 4 liters, depending on how you feed the milk, cooling that milk prior to placing them in the refrigerator or freezer, going back to those pictures that I showed you, and then label the quality and the date, so it's easy for the next person to go into your storage and be able to find the high quality that they need and when it was collected. So when we get into the freezing part of that, again, even your freezer system has to be monitored. So monitoring the freezer temperature, trying to avoid those multiple freeze thaws cycles throughout. So we're not constantly freezing and then thawing it out. So that can reduce the quality of that milk. And then storing that colostrum no more than 6 months for the best quality. And then thawing. We don't want to use a microwave. I know in the past I've seen producers try to use a microwave, and you're really going to zap those IgGs right away. So we want to do kind of a warm water bath where we're thawing that at an appropriate temperature of about less than 140 degrees. And so this takes time, right? So we have to kind of plan for those things. If we see cows calving, can we take that colostrum out at a certain point and be able to, have warm colostrum within a few hours? This is really going to avoid that IgG damage. If we get above 140 degrees, that's where we see some denaturing of the proteins, and then you've kind of you know destroyed all the work that you've done by quality measuring that colostrum to get it to high quality, storing it and freezing it. But then if we damage it during the thawing process, that's another area that we can see there. And then, looking at evaluating your equipment. We want squeaky clean equipment. So these are just some troubleshoots that we've been on, where the gaskets were loaded together and kind of placed together, and there was no preliminary cleaning. And so we see after they took them out of the vat, there was still milk residue around those gaskets. So we have to make sure that we're cleaning things even before we put it into the disinfectant or sanitation. Looking at gaskets. So, here this picture shows some milk residue within that gasket. So it's all these little places where residues of fat and protein can accumulate. So again, kind of thinking about that whole process of where your milk gets collected, and from the time it gets collected to the time it gets fed to the calf, right? So nursing bottles, nipples, the esophageal tube feeder. I'd say anywhere where it's difficult areas to keep clean are possible sources of contamination. And then think about some of those hidden sources, right? So even your calving pen, those calves can pick up contamination within there. We don't want them to ingest manure as their first food. So, trying to keep a clean, dry area. Birth fluids are a perfect environment for bacterial growth. And then calf feeder hygiene. Who's feeding those calves? And do they have clean clothing? Have their boots been sanitized before they're touching those newborn calves? Washing hands or wearing clean gloves? Those are all areas to consider as well. And then looking at your feeding procedures, redipping nursing bottles into the bucket that you're, refilling the bottles, or where those transfer buckets are being placed, right? So any chance that there's an area for contamination we want to look at. So there are ways that we can evaluate our squeaky clean. There are tools available now. One here is on the right. This is a device called an ATP meter or a luminometer. So it's ATP stands for adenosine triphosphate, and it's bacteria obtain energy from this molecule ATP. And the swab will actually pick up traces of ATP if live bacteria are present. And so then there's a chemical reaction that produces a light, and the intensity of the light is measured by this device. So you put your swab into the device, and then it's displayed as relative light units. So the higher the number, the more presence of live bacteria. So it's not telling you the bacteria count, it's just telling you, yes, there's bacteria present, okay? And then on the far right in that hand there is also a quick swab where it gives you a color reading. So you can swab areas and get a kind of an instant reading. It's not going to give you a number, but it's based on the color that it changes. It's going to tell you whether there's bacteria present. And so just showing you some examples here of where you can use this within the farm. So anything that you're, mixing milk or milk replacer with, like your wire whisks, or things that you're using to clean your bottles, so the brushes, anything that you're putting colostrum in to, put it into storage. So you see here, there's pouring it into a colostrum bucket so we can attach the bag to it. Your hoses. Buckets are another one to evaluate. So, on the far right there, the pink bucket, if you saw that picture maybe a little more up close, you'd see it's got a very smooth surface to it, and the reading is fairly low as compared to the bottom right where we have this blue bucket. If you would zoom in on that picture, you would see some discoloring in that bucket. You would also see some cracks and crevices in there. And it does show with that relative light units that it does show that there is some bacteria present in there. So it's harder to clean those, as equipment ages, or if we're not doing routine maintenance on some of our equipment. So Dr. Socket has some calf feeding equipment guidelines of, using less than 50 relative light units as acceptable. And anytime we get beyond 200, we classify that as unacceptable. So those are just some areas that you can look at. You can also do a hygiene audit. So, farms may not necessarily purchase the ATP meter. Their veterinarian may have one, nutritionist or your calf specialist might have one where they might come out to routinely do a hygiene audit. So this could be done maybe monthly. And so this just shows an example of kind of graphing that out and kind of showing, okay, I came in July. Here's what I found. I highlighted the ones that were high. I come back another month or two later, things are maybe reading higher or they're going down. So that also gives some opportunity to talk to employees about cleaning and sanitation. Maybe this is an area that you can do some employee training on and walk them through what protocols you'd like to have done for your colostrum equipment. So I also like to throw in here not only your calf equipment, but what's in your calf kitchen, right? So you don't have to have a big fancy kitchen to hold all your equipment for feeding calves, but do you have a designated area where you can keep things clean? So you think about your kitchen at home. Would I rather eat off the kitchen on the top right, or would I rather eat off the kitchen off the bottom right? I think I'd want to do the top right, where everything is stored and it looks like I can prepare food efficiently, convenient access to food ingredients. My cooking and eating utensils are in storage, and I have access to cleaning and sanitation. So same things with your calf kitchen, having an area where you can prepare, the milk or the equipment that you're using. So access to ingredients and be able to store it and have convenient cleaning. So we want to make it easy for the people that are feeding these calves that first day of life, right? So making sure everything is stored properly and cleaned properly. Again, some of those benefits of having a calf kitchen is just consistency. We know that cows and calves like a consistent routine protocol. And so depending on if you're using powder or you're using, fresh milk, they're getting that same dry matter and volume at every feeding, same temperature being fed at every feeding, same feeding times every day. That's ultimately going to help reduce the risk of bacterial contamination. So kind of think about, things that you can do within your own calf kitchen, whether that's storing buckets upside down so they can dry properly, having those drying racks there, a floor that's easy to clean and has adequate drainage. So those are other areas that can, accumulate bacteria. Adequate supply of water, so both hot and cold as you think about your cleaning process there, and then having a designated place for your utensils like your brushes, hand gloves, or other daily equipment that you're using. So just a little bit about adequate cleaning and disinfecting. These charts here might be a little bit hard for you to see, but I really just wanted to point out that there are resources that you can look into for different products that can help with disinfection and cleaning. So when we talk about cleaning, there's 3 different things that are physical. So the water temperature, the contact time, the scrubbing and rinsing, and then the drying. Those are all the physical things that you're going to do when you're trying to clean your equipment. But then there's also the chemical side. So your detergents, your disinfectants, and your sanitizers. And they all play a role in helping to clean and disinfect your equipment, as well as are they working properly to to destroy the bacteria and get you a clean equipment. So I like to refer people to the Center for Food Security and Public Health. It's a website that does a really good job of looking at different disinfectants and kind of itemizing, what pathogens you're dealing with and what disinfectants are going to be most useful for your operations. So not every farm is dealing with the same pathogen loads. And so you may be using a different detergent, different disinfectant and sanitizer as your neighbor. So this kind of really helps walk through, what they're good at, what the bugs are most resistant to or most susceptible to as far as destroying those. So I really encourage you to go to that website. They also have a good tip sheet on the cleaning and disinfecting process of your feeding equipment. So there's one in English and there's also one in Spanish there. So you want to make sure you get the most worth out of your disinfectants, right? So I know I'm guilty of it as well, looking at labels, right? But paying attention to the labels of the products that you're using. Sometimes more is not always better for some of these products. Contact time is important. So if it says it needs to be on there for a full minute for it to be effective, then that's what's the timeline that you have to use. Also, you can't disinfect manure, right? So things have to be fairly clean before putting some of these disinfectants on, and then trying to avoid what we call cocktails, right? So mixing this with that because we think, well, if we have more is better, I'm going to put those two together. But sometimes those can be detrimental. Okay. And we also want to make sure that the products that we're using, they're being used safely for those employees that are using them. So making sure that they have the proper protective gear, so their gloves, if they have to be wearing gloves or masks for any of the products that they're using. And finally, well, actually, I have two Q's left, but Q for temperature of feeding. So if anybody has ideas for Q for temperature, I would take them. But we also threw this one in here for temperature of feeding because we find that it's really important as we're feeding those calves that first day of life that they're being fed the milk at an appropriate temperature. So I don't want you to get too hung up on the graphs here, but more so just looking at, what is the temperature of that milk coming out of the, either the thawing process or the warming process to make sure that they're being fed a proper temperature. Because if we get it too hot, there's possible injury to the calf, scalding of their mouth. And if it's too cold, they're not going to be able to absorb that colostrum or may just not want to drink it because it's not at the right temperature. So we want to try to make sure it's at body temperature when we're trying to feed it. So that might take some planning as far as, where you have to deliver that milk to the calf. So if you have to travel, from the time that you take it out of the warming unit to maybe an outside hutch, maybe that temperature has to be a little bit warmer so that by the time it gets to the calf, it's at their body temperature. But if you're within walking distance of the calf, it doesn't need to be quite as hot. And then finally, quantify. So this kind of encompasses everything that we've talked about here today, is kind of going back and evaluating your colostrum management program. Did those calves receive adequate colostrum? And so a lot of the dairy calf specialists from around the United States have come together and built this consensus of recommendations on calf and herd level passive immunity. You may have seen this chart. I know the Dairy Calf and Heifer Association has it in their gold standard booklet there, but it really does a good job of kind of categorizing how your farm is doing, right? So putting it into categories of excellent, good, fair, and poor. So once those calves have taken in colostrum, then you can go back in and take blood samples and evaluate, did those calves absorb that colostrum properly. So depending on what you're using, so the serum IgG isn't going to be a farm side test. You might have to send that one to a lab, but if you have a Brix refractometer, digital refractometer where you can measure serum total proteins, you can use these categories to get you to where you are. So at farm level, we want to see at least 40% or more in the excellent, 30% in the good, and we want to have less than 20 and less than 10% in that fair to poor region there. Of course, the higher levels that you can get into the excellent and good, the better for your colostrum management and calf protocols. So just want to end here with a little colostrum management Wordle. If there's any Wordle fans out there, if you're playing this game, get the young calf off on the right hoof. So that's the winning word for Wordle here. But the words that we use in that is be clean, so squeaky clean, feed colostrum quickly, feed ample quantity. We want to watch, so monitor and quantify how those calves are absorbing the colostrum, and grade test. So going back to testing that for quality. I do want to note that Iowa State University Extension and Outreach has some calf care and handling resources. These are available out on our YouTube channel, and they're available in English and Spanish. So they're short 2 to 3 minute videos going through a lot of what we talked about here today, going through passive immunity, some of that harvest and evaluating colostrum, but also taking a look at monitoring hygiene. We find these are good, useful training videos for people on farm because they're quick and you can share them with your employees and help them maximize colostrum management. So with that, Cora, I will stop sharing my screen and I'd take any questions.
Awesome. Wonderful. Let me throw up our survey while we are going through questions. All right. There we go. So folks, if you do have any questions, feel free to throw them into the Q&A. We did have one come in, and also please take the time to fill out our post-session survey. You should be able to pull it from the QR code. First question is, the slideshow showing the different readings on the different surfaces for ATP, were the readings before or after sanitation, or was it a single swab? And if after, was the same sanitizer used on all the surfaces?
So that slide was, I guess, a accumulation of a couple different farm pictures. So it wasn't all from the same facility as far as an hygiene audit. But all those readings were before sanitation. So those were just readings coming into the farm and taking what was there that day, right? So I can't say if the same sanitizer was used on all the surfaces.
Would you say that that equipment was clean according to what the farms did, whether it's like, they washed it with soap and water, and so they had gone through the farm's cleaning protocol and then
Right.
swabbed? Yeah.
Yeah. So, it was after milking, right? So
Yeah.
if those fresh cow buckets, so it was, yeah, after their
Mhm.
shift at milking and then we came in and swabbed those. Yep.
Yeah. Awesome. Okay. Did that. And so on the nutritional front, what should be the main focus during close up on the cow side for excellent colostrum quality?
Sure. Well, on the nutritional front for the dry cow, it's more making sure that they're in healthy body condition, right? So we want a cow that's not over conditioned coming into the freshening pen. We don't want a cow that's under conditioned because those things are going to play into how much colostrum that she can produce, right? So if
Mhm.
she's giving all her energy to just maintaining her body condition, she's not going to be able to put as much into making that colostrum. Okay. So I would say working with your nutritionist to find out what is an appropriate balance for your herd, because it's going to be different for each herd. I can't say specifically which nutrients you want to make sure, so I think that's just a matter of having that conversation with your nutritionist.
Mhm. And I do know a couple of my colleagues have looked a little bit into some of the seasonality behind colostrum production. And because they had received questions of why am I losing colostrum production quantity and sometimes quality when it hits fall or the transition from winter to spring, certain times of the year, that makes most sense for folks in different regions. So there are some on the Michigan State Extension Dairy Team page. There are some resources in that. I can try and find them and I'll link them in the newsletter since this was a question that came up. So I'll add that information in there. Okay, we have another question. How can we help small scale farmers to keep milk or colostrum hygiene in rural areas where farmers don't have proper tools to monitor milk hygiene?
Yeah, that's a good question. I think, just kind of really going back to the basics, right? Of um, it doesn't have to be, necessarily the commercialized products. There's a lot of homemade things that you can do to even help with proper storage. Even just getting them a thermometer, right? So, um, providing them with a digital thermometer where they can just go in and be able to, put that thermometer in the bucket of colostrum that's thawing or the colostrum that they're warming up to feed the calf. That's a simple tool that can be implemented on the smaller scale. Um, a lot of your industry providers have some of these tools. Your extension educators have some of these tools. So if you're just looking for access to resources to help monitor, sometimes just reaching out to them and going through a walkthrough of what you're doing to kind of give you recommendations of, ways to improve it.
Hmm. Yeah, I agree. And when I think about someone's starting off with even they maybe it's one milk cow. They have one cow and they're trying to figure this out. They're trying to do the very best that they can when it comes to colostrum quality. They may not have the thermometer, they may not have the bricks, they may not have some of these tools. So it would be very much stepping into a place of being curious with the owner and seeing what makes the most sense for them and what's really practical for them. Starting small with really simple tools is probably the best way. Then you can build a complete system to really hone in on that stuff. I'd say with that, we don't have any more questions coming in. So thank you so much, Jennifer, for joining us today. I know you took time out of your day and away from a conference to jump in on the webinar with us. So I really appreciate all of your insight and the great on-farm examples. And as I said before, your really applicable tools and skill sets that you bring to producers and calf care teams to really just take in and grab and go with their own operation. So once again, thank you so much for sharing your wisdom and for all the attendees. Please take time to answer the survey. And if you do have any questions afterwards, feel free to email one of us. You will be receiving a follow-up newsletter with a summary of today and also what to look forward to next week. All right. Bye, everyone.
Thank you.